your background on how you all of a sudden decided to want to research these types of material. What inspired you want to write and research obesity code or diabetes code or now cancer code?
Yeah, that's an interesting thing because as a kidney specialist, what happened was I went to medical school in the mid to late 1990s. And at the time, of course, I wasn't really interested in nutrition. That's not something doctors really were taught. You get really no training in medical school and not much in specialty training either. We got a lot of training in drugs and how to do dialysis, for example, but not much on weight loss. But what happened, of course, is that over that period of time, obesity just became a bigger and bigger and bigger problem in the United States. So you've probably seen all the stats in terms of obesity. It's just basically going straight up since the mid 1970s. And along with that came type 2 diabetes. So people who are overweight are at much higher risk of developing type 2 diabetes, and probably the number one cause of kidney disease by far, actually, is type 2 diabetes. So that's really where I started to see a lot more problems with the field that I was in. So it was interesting. So I just treated people the normal way. But the thing is that it was not very satisfying. That is, people would get their kidney disease. I treat them with drugs. I treat them with dialysis and so on. And then they'd still get sick. And eventually it struck me as very strange the way that we treat type 2 diabetes and kidney disease, because if the kidney disease is caused by the type 2 diabetes, then the key is really to get rid of the type 2 diabetes. And the thing that was strange is that if you went to sort of any standard talk from a medical school or university, they talk about how type 2 diabetes was this chronic and progressive disease. At the same time, everybody knew it wasn't true. Everybody, I mean, not just doctors, but everybody knew it was just basically a lie. Because if you're able to lose weight, then your diabetes almost always got better and sometimes completely disappeared. So that wasn't random. Everybody knew it. And the problem was then not how to treat people with drugs. The real solution is how to get them to lose weight so that they don't get diabetes, so they don't get kidney disease. But it wasn't just kidney disease, of course. Type 2 diabetes causes heart attacks, causes cancer, causes amputations. Like, it's the number one cause of blindness. It's the number one cause of amputations. You get these diabetic foot infections that people need amputated. There's all kinds of the number one cause of nerve damage. So it just caused all kinds of problems. Those are the problems that I was seeing in my patients. And I didn't want to treat them. I wanted them to be better. But the only way to do that was to get them to reverse their type 2 diabetes, which is possible because we know that. And then therefore, they must lose weight. So that's how I got very interested in the question of how do you get somebody to lose weight? And that's when I started to look back at the medical literature, because my advantage is that I could go back, I could look through all the literature. And of course, the standard advice for weight loss was, and every doctor, every dietitian would get this advice. They tell people, okay, well, just eat 500 calories less per day, and you're going to lose about a pound of fat per week. Okay, so this is the standard advice that we gave for the last sort of 35 years. And it didn't work for anybody. Okay. And that just wasn't my opinion, right? People were gaining weight. People were getting this advice. They're trying to do it, and then they were not succeeding. So the point is that if you actually look at big databases of how well this advice worked, how often people went from sort of being obese to non-obese, the success rate of this sort of treatment was about 0.5%. In other words, about a 99.5% failure rate of this advice to just cut a few calories. Eat a low-fat diet, cut calories. 99.5% chance of failure. Like, what sort of idiot would give that advice that almost never works?
Yeah.
And the problem, of course, was that it wasn't just medical. Every layperson, everybody in the country had practically done one of these diets, and it almost always failed. So then that's why I started looking back at it and saying, look, what's going on here? Like, this is the stuff that I was taught, I was brought up on, and it wasn't true. And it wasn't true for me either, because I've done these diets and it didn't work, and it didn't work for anybody. So that's what the obesity code was. really going back and looking at this calories in, calories out story that we had been fed, and trying to look at it from a very scientific standpoint. And of course, the whole thing is just garbage, because the whole premise of this sort of a calories is a calories idea is that, if you eat 100 calories of cookies and 100 calories of, say, an egg, well, they're going to be equally fattening, okay? But that's garbage. It's not even true in any sense, because the problem is when you take that food, like you take a cookie and put it in your mouth, and you take that egg and you put it in your mouth, the minute you put it in, the hormonal response of our body responds to that food completely differently if it's cookies, like carbohydrates, or egg, which is fat and protein.
Mm-hmm.
Completely different response from a hormonal standpoint. Therefore, the instructions that we are giving to our body from those foods is completely different. So, for example, you eat a cookie, the hormone insulin spikes way up. Okay, and what insulin does is it tells our body to please store body fat. Store those calories as body fat. That's its job. That's insulin's job, is to tell our body to do that. So when you eat the cookie, insulin spikes up, all of that 100 calories goes straight into our fat deposits that's being stored. You eat that egg, of course, insulin does not spike up nearly as high, and therefore our body can use that energy. They'll use it for different things. They'll use it to build muscle. They'll use it to, burn off, because it's not about the number of calories. Because your body, when the calories goes in, can either store it or it can burn it. But which one it does depends on the instructions that we give our body, which are different according to the different foods. So, when people say a calorie is a calorie, it's like, of course a calorie is a calorie, but I never asked you that question. I never said, is a calorie a calorie?
Mm-hmm.
It's like
Mm-hmm.
saying a dog is a dog. It's like, so what? That's a nonsensical statement. The question I really want to know is, are all calories equally fattening? And that is not true.
So the point is that if you eat a calorie of cookies, or if you eat broccoli, they're not equally fattening,
Mm-hmm.
right? And your grandmother could have told you that, because if you eat cookies, she'll say, oh, you're going to get fat. If you eat broccoli, nobody ever gets fat eating broccoli. So that's just common sense, right? It's just common sense. And it doesn't dispel the myth of a calorie is a calorie, because the point is that if your body has those calories, so say you eat a cookie, say you take 100 calories of cookie, or you drink a big gulp or something, like some sugary soda, right? So you take 100 calories of a big gulp. Well, the effect on our body is different. One, it's going to spike insulin. It's going to go into our fat stores. It's going to store that energy, but it's not going to make you full, right? So if you eat an egg or a little piece of meat, it will make you full. So therefore, the effect on the number of calories coming in is totally different. The effect on our bodies, whether we store it or not, is completely different. And therefore, what we have to focus on is not the number of calories, because we know that's a strategy that has failed, like not just once, but it's failed over and over and over and over again, right? What we have to do is concentrate on a strategy that is going to tell our body to use up some of those calories that we've stored, which is just body fat.